Welcome back to Untold Physio Stories. I'm one of your hosts, Dr. E, with the eclectic approach, modern manual therapy, edge mobility system, and modern rehab mastery, our new online mentoring program, and my co-host, who's also a mentor in that mentoring program.
Dr. Andrew Rothschild, physical therapist, modern manual therapy, modern patient education.
How you doing today, Andrew?
I'm doing well, Erson. How are you?
I'm doing well. So we always talk about loading, and we've often talked about tendinopathies, and a lot of times I get trolled. Like in a particular video that I shared from about a year and a half ago, there was a really jacked physical therapist who had been working on his rotator cuff tendinopathy, or what he said was a rotator cuff tendinopathy, or an impingement or something like that in his right shoulder at my course. And he couldn't do push ups. That was like his pre and post kind of litmus test that we chose. We loaded it up with repeated cervical retraction and side bending. I taught him how to do it with end range, a little isometrics to make it pain free. And then he was able to overpressure pain free, did about 20 sets. It was like a 40-second video. And all of a sudden, he was able to do push ups pain free for the first time in a year or so, 6 months, something a long enough time that a physical therapist should be able to address on his own. And immediately one of the first comments was, "Oh, that's just neuromodulation, and if it's a tendinopathy, you didn't really load it, and et cetera, et cetera." And I'm like, "Look, he already treated it like it was a tendinopathy. I mean, you weren't there at the course to take his whole history and everything. It's just like a 40-second video from a snippet of a course." And also, as a physical therapist and one who actually works out very regularly, he told me that he already tried loading it. So I think tendinopathy research is great, and occasionally it makes me wonder, because actually that comment, even though it upset me at the time, I just thought to myself, maybe I don't load things as much. Maybe when I make them pain free and after just a few end range loading repeated resets and they seem to be able to go back to function, maybe I should follow up with them in a little bit, more than just once or twice more, to make sure they're doing their home exercise program and make sure they got back to their sport or activity. Maybe I should really check a couple other type of more functional tests rather than just have them do, like 5 or 10 push-ups and then go on their word that they're gonna return to workout. So with that in mind, I had a gymnast that I treated a couple weeks ago with what seemed to be like an acute tricep strain. It was painful right around just proximal and distal to her olecranon, and it hurt mostly when she was tumbling or when she was holding a handstand, and especially going over the table on vault. She has to do a couple tumbling passes and then kind of go over the vault, and then so anything where her elbow was extended or she had to be weight bearing in a upper quarter, using her upper quarter to weight bear, it was painful. The first time I tested it, I couldn't reset it. I tried some men range loading strategies, tried wrapping it. It really just seemed acute because when she came to me with it, it was only maybe about 2 or 3 days old. Luckily, it was right around the Easter break, and she was able to get maybe 4 days off in a row because normally I think she might be practicing 6 days a week, and that's a lot. So after rest, she said it went down from maybe a 7 out of 10 in activity, and it was to the point right before I saw her, it was also 4 out of 10 at rest. Even like it was actually escalating. She was feeling it in school, just sitting there not doing anything. And it was also her left arm, and she's right-handed, so it's not even like she was writing with it all day. So after she came back from break, it was a 2 out of 10. It was intermittent. And then I went to go test it, and break test was a little weak. But I also like testing through the range. And testing through the range, like basically starting with her elbow almost fully flexed on the right side, she was able to push me away quite a bit. And with her left side, there was a lot of shakiness. She couldn't quite push me away through the range. And I think that's one of the things that it's just kind of glazed over in manual muscle testing is we often do isometric break tests, and very rarely do we ever test through the range. So I like to test through the range, especially when someone I think is kind of ready to go back to sport. Do you ever test through the range, or are you mostly just sticking to break tests?
No, I test when I did my residency and stuff through Ola Grimsby. We did like sort of like three position muscle testing, so like a mid position, shortened position, lengthened position, which was sort
Hmm.
of like their way of getting a general through the range type test to see if there was a differences in terms of especially symptomology. Um,
Right.
that's how I
And I
do
think
it.
that's right. And I think that's smart too. I mean, we just learned these like static fixed positions that probably puts most muscles in the best length tension relationship, which is probably ideal for the majority of tests. But I think you can miss a lot if you don't test through the range. So when I would have graded her maybe like a 3 through the range, and it's hard because this is like very subjective, obviously, compared to like the standardized test at the 1 point isometric point. So I gave her simply just eccentric isometric push-ups and eccentric isometric kind of tricep kickbacks with dumbbell that she had at home. And I expected, and I gave her that expectation that, hey, look, this may have always been weak, and potentially when you kind of ramped up practice for states, that you were just overdoing it, and the tendon got a little irritated or cranky because the muscle's a little weak and the tendon took a little bit more load. And often these things take a while. It's going to take a while to strengthen, and until it's as strong as it really needs to be, the tendon will continue to be a little cranky. Just don't push it more than 4 out of 5. So she was good with doing it. She had a lot of difficulty doing the eccentric push-ups. I didn't get really a chance because we didn't have dumbbells there at the gym. But with eccentric loading, she was really shaky on the way down. Uh, I follow up with her the next week, and she is 100% pain free. And not all of her strength is back, but the majority of it is back. So I thought to myself, oh, this is something that maybe 3 years ago I just would have found some kind of loading strategy. I maybe wouldn't have thought of it as a tendinopathy, but this time I just thought, hey, you know what? I really want to return her to function. I want to make sure she's resilient, and we're going to do this the right way. But it turns out that just after 1 week of eccentrics, she is completely pain free in all activities, and she's almost as strong.
Hmm.
So I'm not really
Yeah.
sure. Yeah, and that's the thing. Even with like, if you read Peter Malieris's research, or you listen to a couple of his recent podcasts, I know you reviewed one of them recently on social media. He even says that his evidence-based tendinopathy treatment is when they looked at general exercises. He reviewed one study when he looked at general exercises versus specific tendinopathy exercises. The general exercises work just as well. It didn't have to be like specific loading to the glute or whatever muscle they looked at. So that's just where I think, you know, I would probably still give her that, but it really makes me question. I mean, obviously, pain can be modulated rapidly, but I just didn't expect her function to come back so quickly, and the majority of her strength to come back so quickly. What do you think about that?
Yeah, it's certainly interesting, and like I said, there. I think there is some research that shows that there's sometimes a neurogenic component with some of these tendinopathies, especially looking at Achilles, I know, and plantar fascial stuff. And so, how much of that is really neuromodulated versus a true, structural neovascularization, nociceptive driven issue? Or maybe why can't that be a little bit of both? But one has maybe more a dominant presentation on certain individuals.
Hmm. Hmm. And granted, she is already she's it's mostly she mostly uses her right arm. She doesn't use her left arm as much when she does one-handed plants and things like that. So it could be that she only needed to strengthen it just enough, or maybe even just return motor control. But I was surprised, and I'd be hard to classify that as a pure tendinopathy because I would think that overall she'd be a bit more of a slow responder and need quite a bit more loading. I told her to keep up with it, but I don't even know if she did, because it's hard for someone to keep up with something even as an athlete once you get back to full function.
Right.
Yeah.
I've had some hamstring tendinopathy, like for whatever reason, hamstring tendinopathies that have actually been very rapid responders, much more so than I would think, given the general advised timeframes for tendinopathy rehab being like 3 to 4 months.
Right. And I think I understand why. And I think it's also that research is purely looking at it from a loading and isolation standpoint, where they don't do anything else in terms of possibly like pain science type things where they decrease fear avoidance, where they don't do any other neuromodulatory effects like lumbar loading for the lower quarter or cervical loading for the upper quarter, things that could greatly enhance the ability to accept load and
Right.
therefore increase compliance. So I think when you look at things in isolation, you might have slower outcomes,
Yeah.
but it makes sense from a structural standpoint for sure that it would take a while.
And that's how they're doing things with randomized controlled trials. It's a very structured, isolated type of investigation versus like a pragmatic trial, which would more resemble a regular clinical practice, which they're doing a lot now with manual therapy, but maybe haven't fully done that with a lot of other exercise
Right,
interventions.
right. Yeah, I do like the multi-center trials that basically just give you a set a type of patient to work on, and then a program that has to include certain things, but you can kind of do things your own way as opposed to, you know, 3 sets of P to A's and then you walk away like you would ever do that on someone, you know, like, "Hey, without even
Right.
talking to this patient, I'm just gonna walk in, passively measure their straight leg raise, do 3 sets of P to lumbar P to A's, passively measure it again and leave without even having an interaction." It almost does it doesn't even make sense to even think of that as like a clinical interaction.
Right.
Yeah. Alright, so where can people find you, Andrew?
People can find me on Twitter and Instagram at spear_physio. The best place to find me on social media, as well as modern patient education.
All right. Then he's also one of the mentors in Modern Rehab Mastery. That is our one of a kind 3-month online mastery program where you get modern manual therapy, Andrew's modern patient education, and Kyle Coffey's modern strength training or BFR. So check that out, modernrehabmastery.com. Check out all of my products. I just recently launched the Edge Mobility Star, a new little ISTM tool that is the Edge Tools BFF. It's a perfect complement for that. The Edge Mobility Gun, so you can save hundreds on our competitors that I won't necessarily name here. It's a percussion type manual therapy instrument. UntoldPhysioStories.com, of course. Tell all your friends and colleagues about our podcast. Make sure to give us a 5-star rating on iTunes. You can go to subscribe to your various favorite sources like Spotify, Stitcher, iTunes, and Google Podcasts on UntoldPhysioStories.com. Make sure to subscribe to my email list on themanualtherapist.com so you don't miss out on any of our weekly blog updates. So you can also get exclusive discounts on courses and products from Edge Mobility System. And as always, you have a great day.